Welcome to the COVID-19 special for the town of Duxbury. I'm Donna Rodriguez, and today I am joined by Tracy Mayo, who is the health agent for the town of Duxbury. Tracy, thank you so much for taking the time to talk to us today. We appreciate you.
Thank you for having me.
Of course. Now, there's so many questions right now. It's really challenging watching the news, reading the newspaper, and a little scary again, because even with all of the things we have in our toolbox right now related to COVID, numbers are going up and people are concerned. So we thought it'd be great to be able to talk to you so local residents can hear directly from the town what's happening and get some advice or some information. Can you just give us a little bit of an update of what's happening in Duxbury related to COVID right now?
Sure. So in the last few weeks, our numbers have been going up, and our positivity rate was at 7.88%. So we have seen an increase in cases from previously. But we've also seen an increase in people that are being vaccinated in town. So that is good news.
Are you finding that even though there's an increase in cases, is the severity less with so many people vaccinated in town?
Yes, the symptoms that people seem to be having are a lot less than they were back a year ago when people were positive. So
That
that's good.
that I'm sure is a comfort for everybody to hear. Are you seeing incidents of Omicron at this point, or that you're aware of?
We have not had any cases that we are aware of at this time. So
And
that's
and any updates from the school system at this point?
So our school system is actually doing a really good job with every week on Wednesdays. They post the cases for each school on the school public website. And once a week, the superintendent will send out an update as well in an email. And I believe each school does that as well. So it's keeping people in the loop of what's going on at each school.
And that's fantastic for parents and comforting just to know what's happening in the school system also. Now, tell me, I know there have been some changes recently between the state and our individual towns when it comes to contact tracing and statistics and numbers. Can you just give us a little update and tell residents where the best place to go to get information?
Sure. So what we suggest to our residents is to go to mass.gov/COVID. And from that website, you can pretty much find anything you want on there. What they do is the dashboard, so that will tell you the number of cases. It will tell you how many people are vaccinated. You can also find information on isolation and quarantine if that's something that you need to do, whether you're positive or you come in contact with somebody that is positive and you need to quarantine as a close contact. So that site's really where we want people to go to get the most up-to-date, accurate information. And you can also find that link on the town of Duxbury. If you go under the Board of Health Department, we have that link on there as well. So it will direct you right to that.
And the state is updating the numbers and the statistics Monday through Friday at 5 o'clock, so people can get almost daily updates. And people can also sign up and make appointments on that site as well for whether they're going for their first or second shot for vaccinations or even for a booster, correct?
Correct. On that site, there is the Vax Finder, and you can click on that, and you put in your either town or your zip code, and it will direct you to what's close by you. One thing I did want to mention that today, December 15th, the Duxbury Public Schools, in conjunction with Fallon Ambulance and Transformative Healthcare, is putting on a vaccination clinic from 3:30 to 5:30, and they will be doing a second dose on January 5th from 3:30 to 5:30. And this is open to everyone from age 5 through adults, and also if you need a booster. They will take walk-ins, and you can also pre-register for that. So that's kind of a great resource, especially for the 5 to 11-year-olds that just recently opened up too.
Now, do you think that's something that you'll be offering again in the future, or is that something that you would have to wait to see until after the new year?
This was actually set up through the school system, through the
Okay.
public schools, because they have the availability to work with those healthcare systems a little bit easier. At this time, I'm not sure if we would be doing our own. We're trying to direct people to contact their physician or use that VaxFinder where you can go, because there's many pharmacies and other places that people can go to right now that is convenient for them.
And with availability of vaccines, it seems to be easier recently to be able to make appointments and make them in a short period of time. Tell me, when it comes to testing, and recently we've been hearing more and more talk about using at-home testing potentially if you're going to see family, if you're perhaps going back to work after the holidays. Has there been any conversation or any information you can offer us about where at-home testing has a place?
The at-home testing, they're encouraging people that if you have symptoms, or even if you know you're going to be going somewhere, that maybe that might put you at ease a little bit if you have an at-home test. If you do receive a positive result, you should contact your physician, but also treat that as a positive test result and follow what the isolation and quarantine would be needed for that. Those tests are becoming more readily available. Some communities are receiving free testing. We're not one of those communities, but not to say that maybe at some point we won't be able to also get test kits to provide to the community.
Now
that would be my hope. But
yes, as they expand it, definitely, because they've just introduced it in the state for specific communities that have been heavily hit, I understand. Now, those test kits typically come with 2 tests because, as we know, if we were recently exposed, we might not have a positive result. So that second test is intended for 2 or 3 days later. Is that correct?
Correct. That's my understanding.
Okay.
But I would definitely direct people to read the directions on the specific type of testing that they're doing.
And if people do test positive, as you said, they should contact their physician as soon as possible, follow guidelines for isolation and quarantine. But it's also important to get to your doctor as soon as possible to prevent serious symptoms potentially and to get into treatment earlier, correct?
Correct.
Now, one of the other things that I just wanted to bring up with you, there's been such increased conversation about mask mandates and whether or not to return to mask mandates recently. Just over the last several days, excuse me, the CDC has said that if we are any community that is a high transmission community should consider going to mask mandates for any indoor public settings. And the Mask Medical Society just came out, I believe it was either yesterday or today, in stating that that they are recommending mask mandates for any high transmission communities. And actually 22 communities in Greater Boston have already gone to mask mandates. Now, at the same time, the governor is saying he has no current plans to do that. My question for you is, for the town of Duxbury, what are the steps and what would be the process for the town to even consider going to a mask mandate again? How do you consider and what do you consider in making those decisions? Because it's actually a pretty big decision.
So typically with a situation like that, myself, the town manager, and the town nurse will have a discussion about what our numbers are, what the rates are, and then that information I would bring to my board, and we would discuss that at that time and decide if that was something that was necessary to implement or not.
Do you see any indications at this point, or are things fairly stable right now? Because you also have a huge toolkit that you didn't have last spring. You've got vaccinations, you have treatment. There are so many other things that are really and to help to support that people are safer right now.
I don't at this time.
Okay. Is there anything else you'd like to touch on regarding COVID right now in the town of Duxbury, or questions that you are frequently getting from residents that you'd like to answer?
Or actually, I do have a couple things.
Great.
We sent out some information last week to our residents just regarding the change in case investigation and contact tracing in our town. We were fortunate that there was a group called the CTC, the Contact Tracing Collaborative, that we were able to give majority of our cases to for follow-up and contact tracing. And that no longer is available. So now it's up to each town, not just our own town, but every town has to do this on their own. So what we will be doing for case follow-up when we receive our positive cases is that we will be following up with anyone that is in daycares, the school system, long-term care, or if it's a cluster. And so anybody else most likely will not be receiving a phone call from our department stating, you're positive, here's what you need to do. So what we're directing people to do is to go to that state website, and it talks about isolation and quarantine, and follow that steps for if I receive a positive result, what I need to do. And also to put the onus on the positive people now to contact who they may feel is a close contact with them and make them aware of that situation, that they did test positive and they may be a close contact with them. One thing that I do want to stress, and some people don't always remember, that if you are vaccinated, you are not considered a close contact, even if you are within 6 feet for 15 minutes of a positive person, unless you develop symptoms, and we would suggest you go get tested for that. So that's a pretty big change, because anyone that's not in those distinct groups won't be receiving a phone call anymore from anyone saying we got your positive result. Typically, people are finding that out prior to our notification in the state reporting system anyway, because you go to their doctor, you get your test result, and you know right then, where we might not know till the next day or the day after. So that's one big change that is going on in our community. And one other thing that we have gotten some calls and emails about is the weekly letter that we used to put out with our case numbers for the week, how we were doing with that. We are not going to start that up again because we feel that the state website gives daily information, weekly information. They have more resources to draw from, and it's much more accurate information than trying to do it through the town and then the state reporting. And also now with this change where we're no longer able to send cases to another group to follow up on those, it's more workload on the town. So those are a couple of things.
And those are fantastic points. Something I'd like to ask you to do, because since there have been some changes in what is considered a close contact, could you just review what are the key points for people to know who would be considered a close contact to them?
Sure. So schools are a little bit different. They have, they follow the DESE school protocol for that. So this is talking outside of school. So if you are at a gathering and then you become positive, it goes by your positive test date, or if you had symptoms prior to that, then you would go by that day. What then you would do is you would go 48 hours before your positive test result, and anybody that you were within 6 feet for 15 minutes or more would be considered a close contact to you. It doesn't matter if you're wearing a mask or not. Like I said, school's different. So this is talking outside of the school system in a school building. Um, but then once again, anybody that's vaccinated, if if you were to tell them, hey, I tested positive and I know that we were together on this day, if I'm vaccinated, then I don't have to worry about being a close contact unless I develop some sort of symptom. Then you would definitely want to go get tested.
Okay. And I think that might be one of the things that's confusing for all of us is that as we're still learning more about COVID and also learning more about the transmission and the variants, that information is changing regularly, and it doesn't mean that the information we had last month was
Right.
wrong. It just means that things are updating on a regular basis.
Right. So that's why we feel here, at least, it's important that people check the state website because that is going to have the most accurate information on there. And like you said, that it does change. It's very fluid and it's hard to keep up with that sometimes. So that's a great resource for people.
And again, that's mass.gov/COVID.
Correct.
So, Tracy, I just want to thank you so much for your time and for joining us today. I think it's so important for all of us to hear from folks who are in our town, folks who are local, to find out what's going on in our communities and to hear updates and information about how we can get more information to keep ourselves and our families safe. So thank you so much for being here with us today.
Thank you.
I wish you a safe and happy holiday. And I also want to let our viewers know for more information about how to view this special on the Duxbury Government Channel or on demand, please visit the Duxbury page on our website, which is pactv.org/Duxbury. You also can view this on YouTube. And if you want to view this on YouTube, just look up PACTV Video Share. And then under our playlists, you'll see COVID-19 information. So again, thank you all for joining us today, and we wish you all a safe and happy and healthy holiday season.